Welcome to Fields of Study from the Masonic Cancer Center. Today we sit down with Dixie Lewis from the Masonic Cancer Center's CTO-CGI. Hello and welcome to Fields of Study. My name is Max Huber. I'm the Communications and Marketing Manager for the Masonic Cancer Center. In this series, we sit down with some of our faculty, staff, researchers, nurses, and kind of get to know them and see how their lives professionally and personally may have changed during COVID-19 and our stay-at-home orders here in Minnesota. Today, I am so glad to be joined by Dixie Lewis, who is part of our Clinical Trials Office, Cellular Gene and Immunotherapy Division. She is a clinical research nurse and a trial program developer. Say that 10 times fast. I dare you. Dixie, thank you so much for joining me.
It's a mouthful.
It is a mouthful. And while we're talking about it, tell us, what does that mean? What is a clinical research nurse and trial program developer?
So a clinical research nurse at the University of Minnesota here, we help manage a clinical trial here from the startup through the completion. So for us, we're looking at a protocol when it first is written, going through it, helping make edits, helping them, the program manager and the PI figure out how it can be actualized out in the clinic or in the hospital, what will work, what might not work, sometimes suggesting ways to change it. And then we, whether it is an investigator initiated, which we have a little bit more say, versus a sponsored trial, then we don't have as much to say. But so we're helping in the beginning usually. And then from there, we're making in-person training forms. We're helping educate the clinic and the hospital where the patients may have their visits. We are arranging with, we're consenting patients, we're helping with the eligibility screening, and then we're seeing the patients on all their visits and collecting the data. Working side by side with the PI and our CRCs, and so it's really a team effort. And
you mentioned seeing the patients. So right now in today's environment, are you still out there seeing patients and going to the clinic to visit with them?
That's a really good question. So yes, sometimes we are. We are trying to do as many things virtually. So that's really different for us, either over the phone or by talking to the provider and getting the things that we might be able to get without being there physically present. A lot of times we are calling and talking to the patient over the phone or virtually. When I've had patients in the hospital recently, we've really done a kind of a cool thing where I'll call the nurse who has a little like walkie-talkie phone that they take into the patient's room. And then we can do our assessments together. She puts it on speakerphone, and then I'm able to use her eyes for the things that I can't see. Like if I'm supposed to judge the gait of the patient and I can't see them walk, we'll have them get up and walk, and then they can tell me how they're walking, and the patient can also be telling me how they're feeling along the way. So it's kind of a three-way assessment tool when I don't have the eyes to do that. And it's worked really well. It's a little bit more time consuming, but I think it kind of is nice because it gets the staff that are taking care of the patients, like in the hospital, involved, and it gets them more engaged. And they actually, I think, are getting a better understanding of some of the things that we're looking for and what we're doing. So I think it's been nice to help educate even the staff over there of what we're actually looking for too. And but we've also been able, we send in baskets to different staff members that the advanced care providers or the staff doctors, and reminding them that we might need, like a Konofsky, or we might need them to do this assessment, and please chart it in the note. And so that we don't have to be in there in person. So we're trying to be mindful of doing as much things as we can virtually, so we're not using protective equipment. But at the same time, we need to get the data and continue on with the research. And so trying to come up with a new balance with that. So today I was over in the hospital for a particular study as they were finishing the week there, and just kind of gathering and helping the staff and gathering the forms that I had left off on Monday. But every day I'd had a conversation with this patient, and so we were really clear together where we're at, and we were able to collect all the data. So it worked pretty well. So that's how it's different. Normally it would all be in person.
Yeah, and it's nice with the advancements that we have technology-wise that you are able to do a lot of these safety precautionary measures so that you aren't putting yourself or the patient at risk. Because most of these patients that you are seeing or that are part of these clinical trials, they are immunocompromised.
Exactly.
They're already beat down in terms of the health of their body. So if there's any steps that you can take or the other nurses can take, it's got to be a positive for them.
Yeah, and it's had us be a little bit more creative, which is good. And but I also think the benefit of it is really engaged, like the staff on the floor, the nurses on the floor, they're more engaged in the study, um, and they're so I think that's a benefit. I think that's an added thing that they're seeing the benefit of what they're doing, and also being part of the assessments. And they haven't been. I was worried that they might feel that it was taking too much time out of their day, and it hasn't worked out that way. It seems like everybody's really been willing to help out and go forward with this, and it just has added to that communication, which I think is really important. And I think the patients have appreciated it. So it's hard sometimes. Not we're nurses and we like to see our patients, and that, so it's sometimes hard not being able to do that. The cool thing is we're doing this study, the COVID-19 study with NK cells over at Bethesda. They have a Polycom, they have an iPad in their rooms. And even though we haven't yet been able to do this, but we will be doing our communication with the patient via video, via the iPad. So that's a really interesting and new concept to us because we're not doing that at the university. So I'm kind of excited to see how that works out and to see how that communication goes. I think it's going to be really challenging with the non-English speaking patients, because apparently there's a lot of non-English speaking at Bethesda. So I'm really interested to see how that all works with the interpreter and nobody being there in person. So I think that that's going to be our next step of learning.
Yeah, and just the adaptability that you're talking about is super neat and interesting to me. And kind of jumping back to Bethesda, this is where a lot of our almost all of the COVID-19 patients for the state of Minnesota are going. And physical distance, you're located on the campus of the University of Minnesota to try to go over to the Bethesda and then to the Clinic and Surgery Center on campus. It's just, you'd be all over. So having this iPad there and the technology has to be a big benefit. And taking what is normally a cancer treatment and shifting course and seeing how well it works for COVID-19, it's just it's very cool to see how adaptable, not only from technology but from taking a drug and putting it towards this is just mind-blowing to me.
Yeah, it is kind of cool. And I'm really curious to see if we get what kind of results we get, because it could end up being the perfect thing. Who knows? It could end up being what we were made to do for this time. So it's kind of exciting. I would have to say the thing that's been really cool, I think, for me to see it, I've been working with Dr. Miller since the beginning of my career as a researcher. So it's for quite a long time. And just all the novel things that he's done over the years. We've never done anything like this, like at another center. This is something that we've kind of dreamt about, that we would bring cellular therapy like everywhere. And so this is kind of a really cool thing, I think. And I think that for me, having started out, it was just me and Robbie, myself and Robbie and Jeff, that was it. And now putting together this protocol, I don't know, there was a zillion people on it and a great team. And it was really fun to be able to collaborate with all your team members and to see the different strengths that different nurses that you're working with, or the program managers and the different strengths that the PIs brought to the table, the CRCs, just as a group together, working together. This was just like such a colossal, huge event. And it was so fun to it was stressful. We spent a lot of hours in it, doing it. But it was really super cool to see us all work together and so respectfully of each other and of each other's strengths. And I was just really impressed with it. So, the bad thing is COVID, but we really got to see how we could, in a crisis, work together really well. And to me, going from just a small, doing everything on your own to being able to do this as a huge group, it was really enlightening and exciting. And it almost felt like it took a little bit of the pressure off your shoulders because you have such a great group working together. If I can't figure this out and don't know how to do it, you throw it out there, somebody else has the ingenuity to do it, and they just come alongside you and do it. And everybody was just so respectful of one another. It was really great. It was really fun to do.
Yeah, it's been heartwarming to me to see how people have adapted and people have changed and people have used resources to try to solve this problem. Most of the people that are involved in the Masonic Cancer Center are obviously involved in cancer. We have people that specialize in other areas as well, but also deal with cancer. And to try to shift course and be like, well, yes, cancer is not going away. We still need to treat that. But there's this other big problem, and I have some knowledge and insight that could help solve it. So to try to change course, but still, it puts people in a lot of different directions. They're still trying to solve cancer. They're still trying to treat patients, but they're like, I'm going to see what I can do with this. It's got to be neat. And especially for you, like you said, you're collaborating with people that maybe you haven't before. And now you're just coming together as a team and trying to solve this problem.
Yeah, it's been really super cool. I think it's been one of the, probably one of the coolest things that we've done, I think, as a center in not in a long time, but everything's cool. But this was really super cool. And we're open now, and I'm really excited to see where we go from here, because there's still challenges ahead. We haven't done the virtual consenting yet at Bethesda. So there's still some things that we have challenges to do, but I think that we've got really good plans and really good, I'm not as nervous about it had I been not working with the group, just seeing the ingenuity of all the group and how, and everybody's different strengths. I just think it's going to be really super cool to see how it looks, a few months from now. I envision that a few months from now, this is just going to be old hat and it's going to be no big deal. And so we'll see, but
yeah,
it's kind of exciting to look at that. And I think that once we learn how to do things like this and collaborate with not just a whole CTO, but we're collaborating with a whole new group of people. The team over at Bethesda and their research team, and we're collaborating with infectious disease, and it just opens up a whole new world. So I think that this is what we had envisioned doing, and I think this has just accelerated it for us. It's just really put the gas on and we're going.
Yeah. And you have been over at Bethesda, you and Sasha Skenzel, who's part of the CTO-CGI team, over there doing some training. What was that like, being there, actual boots on the ground in this hospital that was converted for this purpose?
So, you kind of get a sense of awe of just going over, because this is what they were set up to do. But once you get there, it just feels like, what we do. I didn't feel like it was, we had to adapt, figure out how to adapt, where to thaw ourselves, and they don't have the setups like our institution does. So there's a lot of things that we had to adapt, but everybody there is really caring and really wants to make a difference. And so I think that, everybody has that mindset, let's do something together. And people were super helpful. This is really new and novel to them. This is way out of their scope. And they have a lot of float nurses that come in. And so this is just really crazy, in that sense for them. Whereas, it's old hat for, if we were doing this up on 5C, this is no big deal, right? So I have to say hats off to them for being willing to go, okay, this, take on this. What's kind of really neat is Sasha set up and helped us set up that we have 3 BMT nurses that actually will be giving ourselves. So that eased our mind a lot, that they really are know how to do this. And I spent a couple days at different times with them training them. So I feel like really confident, and I feel like they feel confident that even in a different setting, they can bring their skill set and their knowledge there and utilize that in a different building. So that was really something really cool that we were able to work out. And we're really lucky that they were willing to go and relocate there. So, but I think it's kind of, I don't know if I was thinking that I would feel really weird or something just because it's, a COVID hospital.
Yeah.
But once you're there and you just are kind of in it, you're taking more precautions, but you're taking those precautions now over at our hospital. So, and I'm not going in a room. It would be really different if you're, going in the room, and I'm not doing that. But I'm really respectful of everybody there, and they're very kind and very helpful. And it makes me grateful for our institution as far as the amenities that we have, because I think, it's an older hospital and they don't have the niceties that we have.
Yeah. And you mentioned, it's a little different, but at the same time, for somebody that's been a nurse for however many years as you have, it's kind of got to be old hat. But what inspired you when you were younger and going through college to become a nurse and to try to help people in this way? Loaded question, I know.
Yeah, sorry. It's a long time ago. I think, I was at McAllister College, and they did these J terms. And so for my J term, one J term, I worked in a nursing home, and really got kind of hands-on. I had to do a bunch of writing and interviewing, along with working and interviewing the nurses as well as the people they were caring for. And I think that really kind of changed the trajectory of where I was heading. And so honestly, I was thinking of medical school, but back then the advice I got married when I was in college, and they told me that you should not be married and go to medical school, of course, which is really unusual for now. You would never hear that. So I decided to go to nursing school. And I loved it, actually. And I worked on the floor for many years. And then when I was in college, I did a lot of research projects and with some of the professors that I worked with there. And so an opportunity came up at the university. They used to have a floor called the General Clinical Research Center, which did all research, but they used really high-level nursing. So we did all the first transplants. We did all the first HIV studies. We did, that's when I first met Jeff Miller, and I did the first NK studies with renal cell, and then I did the first auto NK cells up on the BMT unit. So I thought I would mix my college research piece with the nursing piece by taking that job, and I really loved it. And from there, got recruited eventually to work on some of Jeff Miller's grants, and then eventually joined the CTO. So that's how I got into it. And I've liked it. In nursing, you can change and work in so many different fields and in so many different areas, and have so many opportunities for growth. And I landed, the thing I like about research, it's always changing. You're always growing, you're always learning. There's always something new, yet you're building on things that you already know. And so I think that has been something that is motivating and exciting to me. I've really appreciated in my career, the providers that I've worked with, Jeff Miller, Sarah Cooley, Veronica Bakanova. They've always really, in all of them, but they've always really included me in their thoughts as they're writing a protocol or what, and I think that has been motivating and stimulating to me, that they've always encouraged me to think. And anytime I come up with an idea or a suggestion or a thought about something, they've always been willing to listen and take it in, and sometimes make big changes on protocols based on the things that I've seen along the way. And because of their respect for me, that's helped keep me motivated to do what I'm doing. And it also keeps me really engaged. And I think that's really unique. I mean, I think that it's been the thing that's motivated me. And I think that that's something that happens here. And I think most of the nurses would say that they would agree the same, that people are really respectful of your thoughts and the things that you observe. And you're not just doing a task, you're actually thinking through things. And I think that that was really stimulating and motivating to me.
Yeah, I think the collaboration and teamwork part of our jobs is inspiring to me, and it takes a lot of brain power and a lot of energy. So it's not surprising to me to hear you say that, you know, a lot of these MDs and doctors would lean on you and some of your fellow nurses for ideas, for advice, for guidance on how to do this. They're coming up with the ideas, they're doing a lot of the research, but also at the same time, you and your colleagues are there on the front line. You're meeting with the patients, you're seeing how things go. You've been through this numerous times. And so the teamwork and the collaboration that we see here at the University of Minnesota, I don't want to say it's second to none, but it's way up there.
Yeah, it is. And I think even from the first time that I started, and I was just being oriented to, you know, the whole BMT, because I was not familiar with bone marrow transplant at all. And the docs would take me around on rounds, and they were always teaching me. And I was just so impressed that they would, you know, spend that time and that energy to make sure that I understood something, because they didn't need to do that. And I think it's just that mindset that we have here, that we want people to learn and to be motivated and stimulated and to think. And that was a game changer for me. And that's why I think I've been here so long, is because that respect, that mutual respect, and that willingness to continue to educate me. I'm learning every day. And so I think that piece is what is encouraging to me. And it kind of tickles my, you know, if something's going to motivate me, I like to be a learner, and I like to learn things. And so that to me is really motivating and stimulating to me. So I think that a lot of people here, that's why they stay. When they stay, it's because that's the element that keeps them drawn in.
Yeah. You've talked about a lot of inspiring things here. And I always like to end the interviews with one question, and it's a loaded question, and it could pertain to you personally, to your work setting. But right now, a lot of people are looking for hope. They're looking for hope with just getting outside. There's a lot of turmoil. Maybe they're not able to see their families. People are sick. But what gives you hope? I mean, there's a lot of things out there, like I said, that are scary right now, but in terms of, it could be anything, but what is giving you hope today?
Okay, so I think that for me, my faith gives me hope. I have a really strong faith and believe, and I think that the community that I interface with that hope and my faith, that's what keeps me going. When it seems like everything else is wrong, there's that hope there. So you know, I have a hope in Jesus and what he has for me, and that I know might not be politically correct to say, but that's where, I mean, that's where my strength comes from. And that's what I would say is my hope. Outside of that, I think family and friends, and I feel like, you know, walking around in the community, people are waving to each other and saying hi now. Whereas in my neighborhood, I hadn't even seen a lot of neighbors because everybody's so busy coming and going. And so I think that those kinds of things, you know, that love and that concern for people gives hope. But does that make sense?
Yeah, this
I know, and
whole
so
situation
really,
really puts a lot of different things in perspective. You know, I, as a working dad, I always just took for granted taking my kids to school, and I'd pick them up, and life was so busy, and this has given our family a chance to kind of slow down and put what's really important in front of us.
Yeah.
And I've got to spend more time with my kids in the last few weeks, there are times that it's stressful and you get worked up, but I get to spend time with them and I get to see them grow up, where in a normal everyday situation where I'm commuting, all this, I wouldn't have been able to do that. So what you're saying makes complete and utter sense to me.
Yeah, I'm sure a lot of people out there will say this has been a challenge to homeschool and have kids running around. I was on a Zoom the other day, and my grandson, whom I'm raising, was running back and forth because he had to do his exercises for recess and he couldn't go outside. So he's running back and forth, and you see this kid running back and forth through the thing, and it's a little distracting, but I need to be where he is to keep track of him. So but at the same time, we're all in this together, and we're sitting down, always eating dinner together. And I think that those things are really super important. And it's been a good chance to take a deep breath and be together, kind of reset, and what's important to you. How do you reset that? I think there's some really good things that have come out of this. I hope that it doesn't last forever.
No, I hear you. And speaking of not lasting forever, I'm not going to take up too much more of your time. This is great. Dixie, thank you so much. Is there anything else you want to leave anyone with from today's interview? This has been awesome. Again, this has gone on maybe 20, 30 minutes, and I could probably continue to go just because I'm enjoying this conversation. But any last second thoughts?
No, I just say, I would just say congratulations to us, in the sense that I feel like we've gone through this in a positive manner, and I feel the support from our leadership. I think a lot of people were worried about having to take time off or be at home and worried about their jobs. And I think I've said every day at home, when we're doing our dinner prayers and what we're thankful for, we go around and say what we're thankful for the day. I think every day I've said, I'm so thankful that we have a job. There's a lot of people out there that don't have the same story right now. And I'm so thankful for the people that we work with. And I'm so thankful that I'm just really thankful for that, I guess,
Yeah, I get it. And we're thankful for you and all of our CTO and CTO-CGI staff. So Dixie, thank you. Again, everyone, this was Fields of Study. My name is Max. We'll catch you on the next time. See you soon.